And welcome to the third episode of The Last Zebra. I have the honor of my third guest and dear friend, Dr. Peomia Brown. She's joining me. Thank you. Thank you for joining the podcast.
Thank you for having me. This is amazing.
Thank you.
I'm so excited.
Tell us a little bit about yourself.
So, I am definitely not a native of Louisiana. I feel like a transplant, a foreigner when I come to this state, and especially the city. But I'm from South Carolina. Born and reared in a small town called Utahville, Eutaw, for those who are interested in looking it up. Very small, population maybe 1,300, and that was in 2010. I graduated from Clemson University, so those are the real Tigers, and I apologize for y'all LSU fans out there, the real Tigers. Clemson University, medical school in South Carolina at Medical University of South Carolina, residency in Augusta, and then came to Louisiana in 2019 for pulmonary critical care fellowship and fell in love with the city in the midst of a pandemic. And it was just an amazing experience. Moved to Atlanta and thought, maybe I'll stay in Atlanta. There's a lot more land, Didn't love it and came back here. And so here I am.
And you moved to Atlanta for sleep?
Oh, yeah, sleep fellowship, sleep medicine fellowship at Emory University. It was an amazing year, amazing people. But, I guess I left piece of my heart back in New Orleans. So here I am.
New Orleans does have a special place for those who love this city.
For those who love the city.
If you love New Orleans, I think Drew Brees said it. If you love New Orleans loves you back. Do you feel like New Orleans has loved you back?
I actually do. I mean, I think that's what brought my family back because of the connections that we made, the people that we, family members that were friends first. And we missed that. We missed that being away. We missed the rich culture that I didn't even know I needed until I left. And I thought, this is it. This is a place that I would want to be. So,
well, we're certainly happy that you guys came back. We met in fellowship, UMC, University Medical Center here in New Orleans. And we kind of just hit it off. And our daughters are best friends.
Very best friends.
So they'll tell each other that. How did all of this start? How did medicine start for you?
Ooh.
From the very beginning. So did you always want to be a doctor? How did all of that start?
I will say it could be a long conversation.
We have time.
Oh, okay. We got time. So my mother, my aunt, and my grandmother opened up an assisted living facility when I remember being 3, and they built this building, which my father pretty much built. My father's a contractor, brick mason. So they built this building that wasn't far from my home. And so from that inception, I learned what it's like to care for people who needed care just by being there with them. And I remember the residents who were there. And I remember Mr. Henry, who could not speak, but could say a lot, but not speak and couldn't walk. So I kind of grew up in a medical service kind of community, if that makes any sense. But I didn't really, at that time, of course, growing up, I didn't think that I would serve people in that way. My father got ill when I was in 5th grade. He had a stroke. I was actually at school when he had a massive stroke that left him a little bit debilitated, but he spent, 2 months, and I may be wrong, about 2 months in the hospital recovery. And then that time, like being in the hospital throughout those experiences he had an aneurysm first, and encountering the healthcare system in an emergent type way then, and then encountering it in a prolonged setting, I got used to just being in the hospital or being in a position where I'm seeing people who need medical attention get care and how that was delivered. So I would say that's kind of where it blossomed, right? I have a sister who needed more psychological help. She was diagnosed with schizophrenia and she's mildly mentally delayed. So growing up with her and understanding what health was like in that aspect, from that perspective, then my father getting sick, and then the community where people needed, like the medical assistant labor, was just like, well, I don't have to be a teacher, and I don't mean that in an inferior type way. My entire family, they're all educators, moms, teachers, sisters, principals, professors. So it was kind of, well, you could do that because you know that life and you know the lifestyle of being able to have summers off like that. That's clutch. Right. Summers off and family vacations and being able to meet so many people and watch them grow up. So I thought that that's what I would do. But the introduction, and I think really submerging into the medical community in that way, just kind of made sense. Fast forward to going to Clemson, first class. You go from making perfect grades to, what is this? I don't know biology. I made a D. What is a 53 on a test? And I thought, okay, this is not for me. And withdrawing from that class and changing my career path for an entire half of the semester, I was like, I'm doing graphics. I'm an artist. I'm going to do all these things. And I did, and I loved it. But something was missing. So I went back, finished with biological sciences at Clemson, did some other things, a lot of other things actually, and then ended up coming back. So after getting married and doing the things, I was a dialysis technician for 3 years before even thinking about medical school. Wow. I was like, if I'm going to do medicine, let me see, like, can I do this? And I loved being a dialysis technician. And it was really my husband who was like, okay, so when are you going to apply to med school? Like, when are you going to do this? So that's how it really got started. So it's a lot of details in that history or in that story, but that's what led me here.
It sounds, I'm hearing a story of perseverance. Do you feel that way? It sounds like you've had certainly a lot of obstacles that tried to prevent you from being who you are today, and you've persevered over all of those.
Yeah.
Do you feel that way?
I do feel that way, but I think more than, definitely perseverance for sure. Like, that's definitely a part of me. And that's another long conversation, a tangent in itself of how you overcome different things as a Black female doctor in medicine. Like, that's a totally different way to try to navigate doing what you love in a world that really hasn't been built for you. Right. So yeah, perseverance was definitely a good word to describe a part of that journey. But to be completely honest though, I think that my experiences though really helped make that decision for me. It was like, okay, so you can do this. Like, you really can. It's an opportunity. You've got supportive parents who literally have given you everything. Right. Despite hardships, I was exposed and had opportunity to do literally everything. So why not medicine? That's kind of how it felt. So it was more of those experiences shaped my decision, if that makes sense.
Yeah, absolutely. How then did you go from, because there's medical school and you get exposed to so many different aspects of medicine. I think one of my favorite things about medicine is I truly believe that no matter what facet of life that you come from, there's a role for you in medicine, right? So whatever talent you have, whatever talent you've been gifted, whether by nature or nurture, there is room for you in medicine. There's so many different specialties, so many different skills that apply themselves in these different specialties. So I think for me, I came to be a pulmonary critical care doctor essentially by a process of elimination. I knew what I did not want to do. I was just talking to a medical student today, and my advice to her is to, as much as you want to know what you want to do, it's probably more important to know what you don't want to do, what you don't align with, or what doesn't fit well with your personality, your talent, your strengths. And so I knew I couldn't, there are certain things that I couldn't do. I knew what kind of man I wanted to be and what kind of physician I wanted to be. And that also eliminated some specialties for me. How did you get to internal medicine, pulmonary critical care, sleep?
It fell on me, like literally. Literally. So of course, I told you I was a dialysis technician.
Right.
So I was like, I'm going to do nephrology, right? So throughout even medical school, my research in med school was with the dialysis population, renal failure population. I made so many connections with people, even across the world. I did research abroad. Like I did, not abroad, but in the United States, I did different programs with nephrology. So I was like, I went into my residency. I knew I wanted to do internal medicine because I knew I wanted to specialize and it was going to be nephrology. At least that's what I thought. My first as an intern, I think it was my second rotation, was in the ICU. I was terrified, like so scared. I was like, oh my God, I do not want to be in this place. And literally that's where everything lit up. It was like I was firing at all cylinders. I was scared at one point. I was excited at one point. I was able to, like, it's so much in critical care medicine. It's medicine on steroids, and it satisfied every facet of me. But I didn't know that until, actually, I just thought about this the other day. I had two patients come in the same week. A guy who had literally drank himself into in a toxic ingestion of alcohol. Needed to be on dialysis. And of course we needed to treat him after doing all the math, the renal calculations and spinning urine and looking at pee under a microscope. Okay, we need to treat him. Well, the medication that we needed to treat him, of course, is a national shortage. We don't have it. So what's the next best thing? Literally alcohol. I had a calling poison control and getting the calculation of how much alcohol to actually give a patient every hour, literally. So I had pharmacy come running in the ICU with a medicine bottle of Everclear.
That's hilarious.
Everclear. It was so proud. They were like, here you go. And so we'd already calculated how much to get to.
Everclear is horrible, by the way.
It is absolutely horrible.
It's bad.
It puts people completely under, but it saved this guy's life. So we were giving this man Everclear and spinning, like doing dialysis, giving him Everclear. And then literally 2 days later, a lady came in and with a suicide attempt. She was still awake, but very like somnolent, obtunded. We spinning her urine, right? Found out, well, we're going to treat you the same way we treat this person. So we made this lady a screwdriver. And for those who don't know what a screwdriver is, I actually learned what a screwdriver was that time. It's the orange juice and vodka, whatever. We gave her a couple cocktails. She drank until she couldn't drink anymore. And then put an NG tube in her. Like we were giving her alcohol through an NG tube and she got better. And I was like, this is wild. It's so wild that I'm so excited about giving, like, what's the next option? What can we do to save somebody's lives using the tools that you have?
Solving problems. On the spot.
Like, it was so much fun. But what's made me say no to nephrology was the nephrologist runs into the ICU and says, we found crystals in the urine. And we all were like, yay. It's pee. Like, we don't care. And literally it clicked and was like, okay, so that's not for me. Because I'm not going to be excited about that. But I'm definitely excited about finding ways to treat and heal these people. That was such a good experience.
I will say that my second guest, so the guest that preceded you, was a nephrologist, Dr. Gupta. And he obviously has a different take on nephrology.
I know.
And so he stayed in nephrology. He's been in nephrology for the past 2 decades.
Wow.
And so he highlights it in a very different way. Shout out to the nephrologist.
Shout out. Love you.
Shout out to the nephrologist. But yeah, I agree. I think the ICU to me is it's where I feel the most calm. The floor drives me it's like so chaotic up there. It's bizarre because people come down to the ICU and, oh my goodness, it's so
like,
scary.
and I'm like,
it's the most calming place for me in a hospital, right? You have a sense of control in the ICU. You have a sense of organization. You know what you need to do. It's also very intuitively protocolized.
Yeah.
So, you kind of, when the patient presents, they present with big picture problems. And then you dial your way down, right? So like right now, there's usually something that you have to do right now.
Yeah.
And you know what that is.
Yep.
And that to me is comforting.
I'm sorry, but to that point, what's also comforting is I'm also that instant gratification. Like you can do something. You can literally pull somebody from the brink of death. But we also forget about that part of care that maybe we can help make this process comfortable. There's a transition, and that's still care. And that's what I also fell in love with all of the experiences that I've had. Like, we feel like delivering bad news and saying, I can't help save you, but I can help you transition and make that look comfortable and peaceful and calm and maybe even joyous in a sense for you and your family members. I literally, in the same experience, the same month of being in the ICU as an intern, there was a guy who'd come in and he had an addiction. I think maybe alcohol was the theme of my first time in the ICU, but he had liver failure from alcohol and he was dying. And this wasn't his first bout of these acute types of illnesses. And his sister came in and he was completely encephalopathic, didn't know where he was. And his sister came in and said, he wouldn't want to live like this. I don't want to. And it was the time to intubate, dialyze, doing all of the things. And she said, he wouldn't want this. He wouldn't want to be this way. And which is also funny is I think she found comfort in knowing that I wasn't moved by the fact that he was a little bit touchy, but he didn't know where he was and I wasn't going to hold that again. Like, let me help you. Right. And I think she found comfort in knowing that I wasn't moved by his illness and the consequences of his illness. I just wanted to make sure that he was taken care of. And she helping them make that decision at transition as an intern, they were looking to me in this room. All of my attendings are sitting down and they're looking up at me. What would you? And I'm thinking, little old me. But it was just about how you care for people and the times where they need it the most. And that care that family members can see. Like, that was important to me. And that allowed me to also exercise, I would say, gifts that I've been blessed with. And being able to talk to people and not let hands go. But in those times where people are transitioning to now is the time where you need to actually not physically lay hands, but be present, be there, because they needed you the most then.
Right. I have always thought of medicine as, I've always thought one of the greatest gifts of medicine is the way we slide into people's lives almost unnoticed and slide out. And what happens is, especially in the ICU, I've noticed this, especially in the ICU, is we leave such permanent marks on people's lives. I can't tell you how many times I've seen folks that have thanked me for how I took care of a dying loved one. And in those moments, I don't probably remember the family, but they certainly remember me.
Exactly.
And that is a lesson in humility because they're paying attention. You leave such an indelible mark on these people's lives that there are no words to describe what that feeling is like, especially when it comes from a place of gratitude and thankfulness. And that is one of the greatest gifts that medicine has ever given. I think we get to be part of unique family situations that and I've always thought of, especially in those situations, that we get to see what a family really is like. So in the space of one visit, maybe 2-3 visits, you understand the family dynamics almost immediately. You're like what's that? Like a wallflower, or what do you call
fly
it?
on the wall,
A
or
fly on
something?
the wall, and you're observing all the family interactions. Who was there for longest? Who is the primary caretaker? Who is the mean uncle? Who? All of it fleshes out when someone that everyone loves, or whatever the case may be, is on their deathbed. So I've always cherished those moments, and I agree with you. Care, especially end of life care, has become something that I've taken very personally, just because I know, highlighting what I just said, just because I know how much that means to these people. So then you say all that, and then you go and do sleep.
Ooh.
How did that happen? You became a sleep physician.
Yeah.
What?
So in all transparency, I did sleep because I was like, when I'm old, am I going to be wanting to walk around in the ICU? So being in the ICU, 12-hour shifts that end up being sometimes longer, 16-hour shifts. Am I going to want to do that? Am I going to have that longevity? Maybe not. And being a pulmonologist is also a part of that. But I thought I want to have the opportunity to do more than just these things. Sleep is one additional year. And to be completely honest with you, after doing the fellowship even, I realized how, again, that instant gratification. You are coming to me with your sleep problems, which is the umbrella of sleep is not just what we think about as sleep apnea. Like there is insomnia. Like I just can't sleep, or man, I sleep too much. Can you help me not sleep my life away? These are things that people say. Or man, I'm laughing. A couple will come in and say, hey, I'm laughing because, man, my partner beat me up last night while we were sleeping.
Oh, Lord.
Actually, that's not normal.
Right.
That's not normal. And that could be a sign of some other problems that you may have. And you change one thing or give one device and they come back and says, I've never slept so well. Partners come back and say, thank you so much. Man, that immediate gratification that you can get just by changing people's sleep patterns or talking about the things that bother them about their sleep, their daytime aggravation or irritation and what that means. Like, I found it very it's so gratifying. And so when I'm tired and I just kind of don't want to be in the ICU anymore, which I don't know when that would be. And even now, like I can do this. I can read your sleep. I can see your brain when you're sleeping. Literally, I'm reading your sleep studies. I know what's going on with your brain when you're sleeping. That's, to me, doesn't that sound like cool though? Am I just nerding out right now?
Yeah, you're being a sleep
I'm being
nerd.
a bit nerd.
You're being a sleep nerd.
Okay, fine. But like I can look at your brain and see what's going on when you're sleeping.
What? So you just finished sleep fellowship, right?
I did.
Was it what you thought it would be? More, less?
Much more than I thought it would be.
Okay.
Much more. Because like I said, like even so we're exposed to sleep with pulmonary medicine.
Right.
So we know what sleep apnea is. We know how to read. We're introduced to sleep studies and how to identify different issues. It is so much more than that. So much more. And not only that, it's a lot psychological complications or issues that people may have that affect sleep, but even deeper than that. Example, I had a patient. So I did a lot of VA. A large amount of my time was spent at the VA in Atlanta. And Atlanta VA is huge. A lot of issues that I think people are frustrated because it's so big and they serve so many people, right? I had one gentleman who came in who was actually transitioning. So a transgendered man came in and he felt like nobody was paying attention to him. So he started talking about his sleep and he started talking about the typical, I'm snoring, I just don't rest, I'm hot, I just feel frustrated about life, right? And the more he spoke, it became more of this is actually more of an emotional and even psychological issue. So then our visit transitioned to tell me about how you're feeling emotionally. Well, my son is now fighting with me because I am not nice, or I snap at my son, or my wife is frustrated because I'm not paying attention to her and fighting with son. So we started talking about that. And as I'm talking about this issue, then I went, wait, looking at labs, I'm looking at stuff. And I'm like, wait, your testosterone levels, you're on replacement, they're higher than they should, like 3 times higher than what they should be. Well, high testosterone, or generally in men, have increased risk for having sleep apnea, especially the older you get, but especially during a process of replacement. Like, you're agitated, you're frustrated, you can't sleep, you're snoring, you have all these problems. And I said, hey, did you get any notice about this thing? And she said, nobody called me and told me. He said, nobody called me and told me about that. And I thought, well, this may be a lot of your problems.
Right.
While you're going through your hormone replacement therapy, let's look at this aspect. And that wasn't a part of that conversation wasn't a part of a questionnaire, like our typical questionnaires. It came about with a simple conversation, like, tell me what's going on with you. And we were able to narrow down, like, hey, aggression, frustration, all that, it could be this part. Well, he came back and he was like, Dr. Brown, thank you. You're leaving. You're the first person, not because of course fellowship was over. You're leaving. You're the first person that actually paid attention to me, that listened and found something that probably nobody was going to take the time to find. And not because of negligence. It's just the volume is just heavy and it can be overwhelming. But something as small as that was great.
Right.
Great for that person.
And certainly it sounds like it had a pretty profound effect on his quality of life.
On his quality of life, on the family's life. Like, it was such a burden. And it was just a small adjustment. In addition to, like, of course we did testing and we did all the things, but that part brought so much comfort for him, even to the healthcare system. So it wasn't about the mark that I left. It was, well, shoot, I just met Dr. Brown. Maybe I'll come back and see the next person.
Right.
We have an effect on how care is delivered and received and perceived, not just for the one patient, but for the patient that they refer, for their family members. And again, this is why I think the holistic mindset of medicine is important. The holistic mindset of what care looks like. Care is not boxed in. And I think that's another that brings me back to my reasons for doing critical care. And then, of course, now pulmonary medicine and sleep. I wanted to be all inclusive.
Okay.
I want to be able to reach people in different aspects within the scope of what my training and my license and my medicine degree will take me. So that's why I did it. And I am really excited.
So you've been out of training now for three months. You started working as an attending with me. She's my partner. What's that like? What has that been like?
It's funny because you asked this question. You asked this like not too long ago about like, when did you feel like, wow, I'm done?
Right.
You know? And I'm going to tell you, man, it feels surreal, but it didn't hit me after I was done with sleep fellowship. It hit, and it's like a gradual release of, oh, wait, I'm here. Like, I'm actually doing the job that I've been trained to do after I started, because it felt like, was this all worth it? What, 4 years of undergrad, 4 years of medical school,
3 years.
3 years of internal medicine, plus another year because I did chief year, which it was wonderful. I wouldn't trade it for the world. Then 3 years of pulmonary fellowship, and then like seriously, I have my colleagues, I have my friends from med school who are like surgeons and had their own practice and been out for like a couple years now, and I'm like, why? What am I doing? So it's just now feeling like
it was worth it.
It was worth it.
So you would say it is. It is worth it. I was just telling.
No, it's worth it.
It's a long, long, long road, but it's 100% worth it. It's 100%. certainly vouch for that. I think I've said this many, many times. Who I am today is so appreciative of every version of me that went through
Yeah,
it.
you said that.
Yeah, I am so proud of all my past versions. Good job, son. Yeah, it's absolutely worth it. And you feel the same way?
I do. But you know, it's funny because I'm thinking about that same conversation that we had when we were in lunch. You said if you, I'm going to butcher it. The question, how you asked, like if you had the opportunity or if they told you you could not practice medicine with all of the training that you have and I have to start over.
Would you do it all over again?
So my immediate answer to you was no. Like it was a quick no.
Right.
And after I heard your response and one of our other colleagues' responses, I went home and I thought about that. I was like, why did I answer no so fast? Like, what's wrong with me? Like, I thought something was wrong with me. But every time I think about it, though, I couldn't change my answer. Not because I don't appreciate the journey, because I feel like I wouldn't trade it again. But if someone came to me and said, all of that, we're wiping the slate clean, you start over, I will have to say the journey was so great and so humbling, and it gave me so much, and I still wouldn't do it again. Because the same journey that taught me how to be a good doctor, I would say a good doctor, it also taught me that there's so much more to you, me, as a human being that's not in this box.
That's awesome.
Like, it's still not. I can have that same healing ability and doing something else.
What would you do?
You asked me this. You asked me this.
If you couldn't be a doctor, if you could not be a doctor, I mean, I know you just started being an attending and all, but again, wipe the slate clean.
Wipe it clean.
You cannot be a doctor. One is growing up, what else would you have done? And then now, let's say you were to not be a doctor, what would you do? So was there anything else you dreamt of? So for instance, for me, I wanted to be a pilot. I'm still fascinated by planes to this day. And I would learn to fly a plane, but I'm terrified of plane crashes for sure. So I would learn, but I think I'm okay.
You're all right.
I'm okay flying as a passenger.
Yeah, I'm good.
But I wanted to be a pilot for a very, very long time. And I think a part of me, a boyish part of me still wants to do that. And I wanted to be an astronaut. And I know it's every boy's dream is to be an astronaut. But I think those are probably, I would argue that those actually supersede being a doctor for me.
Really?
100%. 100%. I would, if someone was to be like, yo, today, you could.
That's so interesting.
You could be a pilot and, you wouldn't it wouldn't compromise the things that really matter to me now. So my family would be taken care of, blah, blah, blah. I'd be a pilot for sure. Or an astronaut. Of course, those are two very different things. But I love the cosmos. I've always been fascinated by the stars and all that stuff. But yeah, that's what I would do. What would you do? I
would be a creative because I am a creative. So, and I don't know, I think that's not a career actually.
It's not a job,
it's not a job.
But it's
all right.
It's a good place to start.
Okay, let's start. Okay. So, and I guess I say that because I want to do so much. Like, I'm into so much.
Okay.
I love to work with my hands. So I feel like I could easily train to build things, carpenter, furniture, whatever, because I love that. I could easily do that. I love events, planning a business, of making things happen and be beautiful for people. So I love that. I love design. I love color. I love those things and making spaces warm. And I'm getting excited about it now, design? Like interior design, event planning, create, even an artist. Like, let's even go even further. And I say creative because I love the arts. So no, I definitely wouldn't be painting. That's not something that I would probably enjoy, but I enjoy the idea of creating a space with art. I love, believe it or not, I love dance and the idea of dance. So if my mother said, all right, we're gonna put you in ballet at 2 and this is what you'll do, I would do that. I might not be built for it, but I would want to do dance in that way because it's an art form. So I would just fall over in that because I love that still.
Is there a space in medicine where you can apply that passion? Have you thought about that?
I have.
Have you thought about, is there something in medicine that will allow you to express that creative side of you? So art, dance. Is there a space in medicine? Have you thought about that?
No, I haven't because I feel like I spent so many years just trying to let's get to that point. Okay, we got to that and go to the next. So I didn't think about that.
That would be interesting, right?
It would be interesting.
How can you express that? I mean, is interior designing for a hospital, does that count? I don't know if that's not what you're talking about.
That's not what I'm
You
talking
don't
about
put
at
up
all.
pictures for the patients to see, like UMC. I think UMC.
So I was thinking about that
Yes.
when you said it. I walk down halls and I'll stop and I'm looking around like, man, I want this piece, or look at this photograph. I love that. So yeah.
But it's not quite what you mean.
No.
Okay. I don't know how you can. Maybe I'm sure someone has found a way to be a creative in the space of medicine, and I don't know how you would reconcile those two because they do seem to be rather far apart.
They are.
One is very rigid, and we do say the art of medicine, right? But
Yeah.
it's not exactly that kind of art, right?
Yeah. The only thing that I can think about that I'm excited just thinking like you could like planning a beautiful event. Like I walked down Magazine today and I saw a very common little square and I can't remember the name of it, but I thought, oh, this will be a perfect event for something for our friends if we had a party, if we did something. I could think about planning an event for a subset of patients for this. Like that would be something that I would like run to do. But that's a good question. There's lots of different types of therapy in medicine, music therapy, there's art therapy. There are lots of different things that we could do that we can bring into our facilities that would help patients. But I don't know how I would be a part of that.
It's something to think about for sure.
Something to think about.
Instead of maybe beyond sleep. So
You're right. You're actually, I told my husband my she shed's going to be lit. Like I'm going to have all the things. Yeah, I'm going to have a little she shed with all of the things with my art and salon. Because, of course, I'm like what we call a kitchen-tician. Like I love braiding. I had an actual braiding license for a short period of time. So I braid hair, nails. Like I like to make things beautiful. I like to express in color, in style, it makes me happy.
I love it. What has been some of the unique challenges that you would say, like what's the biggest challenge that you have encountered being from the very beginning, from say undergrad to today, being a Black woman in medicine? Now that's a heavy topic, but unique challenges that you've noticed. And I will freely admit, obviously, as a Black man myself, I think we tend to coalesce Black people in general.
Yeah.
But I would make the argument that a Black woman's struggle is very, very unique. So in medicine, what is that? How has that manifested for you?
Repeat your question. What manifests? Just repeat that.
How has I think being a woman in medicine is a unique challenge in and of itself. Mm-hmm. I think being a Black woman in medicine is also just as unique. In what way has that being a Black woman in medicine, in what way has that been a different experience than what you may perceive any other person has endured?
Oh, okay. I understood your question, but I wanted it to be clear. It's a difficult question to answer, not because I can't find experiences to share. It's difficult because it's so many and for different reasons, for different. I feel like in medicine, it is, and I say this a lot, this is a white man's world, a white male's role that over decades, centuries, whatever, has expanded to include people who are of the minority. But the higher any ladder you climb, you don't see a lot of people who look like you. And what I mean by that when it comes to the ladder in medicine is the subspecialties, right? So when I started Pulmonary and Critical Care Fellowship, at the year that I started in 2019, I think I was one of 23 or so Black female Pulmonary and Critical Care fellows or in the United States.
Wow.
And certainly I think, and I don't know the specific statistics for Louisiana and LSU and New Orleans, but I know that I was one of very few that you can count on your hand that's matriculated through the program, right? And I think that alone speaks to how heavy the weight is to carry for being a Black physician, but also a Black female physician, right? Because I will say that a Black woman's burden is something that has been conditioned for hundreds of years. Like we've been conditioned to carry the weight of things, to nurture others where we have become secondary. So it is, at least I know in my growing up community, right? You're tough. You push through. You can do anything, but also like you're just gonna have to bear it and do all the other things that you are expected to do, in addition to all the things that you want to do. So you're boss mama at home. You're a boss wife. You do whatever you do, things you do well. And I appreciate the doing well. And I think that's just in general. We all should strive to do well. But there's a weight of, as a female, Black female physician, is on the community that's looking at me that I'm not really a part of. I'm the minority. And it's like, oh, you're the exception. Oh, your family must be proud. Oh, you don't get the benefit of the doubt. It's more of we expect for you not to do great. And so when you do great, it's, oh, really? It's a different type. So that's that weight, right? And then there's the weight on the community, of your community. It's like, we're so proud. And I appreciate it's kind of a push, but also it's like, I kind of just want to be able to
breathe.
I just want to be able to breathe. So when I started, and so the example, when I started my Pulmonary and Critical Care Fellowship, I had a 3-month-old, my baby. I moved to the city that I initially said that I felt like a foreigner in, because New Orleans is an amazing city, but it's definitely different. It's like it's like a world in the United States. Right. It's not like any other city that you go to, right?
It really doesn't belong in the United States.
It really doesn't. Yeah. It's solely different from every, to me, facet of it, right? So I moved to this city. I moved with my daughter. My family is away, 9 hours away. And
not to mention COVID.
Well, before we even get to COVID, this was 2019. COVID wasn't even on the radar, really. Like it was there somewhere else, but it hadn't. the radar. But I started my fellowship with a child, but also not recovering from even my own personal things I dealt with. So full transparency, I had a stillbirth, 6 months, delivered her, got pregnant again, had a baby, and moved. I wasn't ready for that. I emotionally wasn't quite ready for that experience. And I didn't realize that I wasn't ready until I was here. And it's like, okay, so we have to do it, because I feel like as women are weird to, you've got this, let's keep pushing, you're good. Like you can encourage yourself, you can go. And I moved in. There wasn't even a space, I think, for me to even be vulnerable at work, because you have to perform.
Right.
So I remember I have a lot of first experiences. My first ICU rotation, walking into the unit, rounding, there was a woman with child who was essentially dead. Mm-hmm. She died. I don't know what her cause of death was, but we were keeping her body alive for the sake of her baby. And I was supposed to go in and ultrasound her lungs just to make sure. I'm supposed to do an ultrasound. And I physically couldn't do it. I was like, I can't go in here. I can't do it. I couldn't go to the door. And my attending came to me, not really knowing full story, but I was like, hey, I just can't. And it was a side hug. All right, you'll be okay. An hour later, I received a text. What did it look like? Did you go see it? And I thought, it's still a mandate to perform. And when you don't, you are, like I said, we're not given that benefit of the doubt, or we don't start here and digress or regret. We start here, and there's a climb to prove that I belong, when everything that I've done in my life up to this point says that you're more than belong here. Right. So not only am I dealing with the stresses of being here, when I'm really here, it's that my mentality and my emotion is set at imposter. I'm not supposed to be here. So climbing on top of that, fighting your own
self,
that was hard. It was hard. And so I think that goes back to my point of, when did you feel like, whoo, you're done? It didn't feel like that for me until I started. And it's like I'm chipping away at, am I supposed to be here? I'm still chipping at, wait, is that my name on that? Really? Am I supposed to be here, when everything that we've done up to this point says not only are you supposed to be here, but you're on the top of this list.
Right.
And I think what I've learned from my experiences, again, wouldn't change anything. What I've learned is I'm so much more than the title of physician. And the title doesn't come without the weight and the work, right? So we did it. We did the work. Mm-hmm. But not only am I a physician, but I am wife, I'm mom to this amazing girl. I've got friends that actually like me. People actually like me. Right, you like me, right? I've got people who like me and who appreciate the value that I'm as a person. And for me, that means so much. But I learned that through this process of understanding who I am and knocking down these walls, the myths, dispelling all of these myths of what I'm capable of. And it came at a cost of finding what I am and what I'm worth, and how I can practice and serve others also came at the cost of me. But now that we're here, it's wait, no, there's so much value in it. And I feel I hope that answered the question, because I feel there's so many facets even to the answer. But the majority of the struggle was from me.
Right.
Overall, so many experiences, but the majority of it was from me, because I don't want to let people down. I wanted to prove that I belong, because I'm fighting to show people that I belong. But actually, you're realizing that I'm not fighting to show anybody anything. Be who we were already created to be and equipped to be. And if you need a break, take the break. Take the break because you deserve the break because you're human. You need it.
Is that imposter syndrome? I think it's probably what you're describing.
It is imposter syndrome.
I wonder. I've always wondered what drives imposter syndrome, because I feel like I have that. I know I have that. I have it sometimes. There are certain settings, certain rooms for sure that, that weight of do you belong, is a little bit extra, right?
Yeah.
And I love the way you said it. Everything that you've done up to this point is testament that you are. I read something once before about how it's important to, when you tell yourself you are who you say you are, that you have proven to yourself exactly just that. So when you tell yourself you are who you are, you've already given yourself, you've given yourself evidence along the way to justify that. And I think what imposter syndrome is that you forget those justifications. See what I'm saying?
Also, I also feel like you not just forget it, you don't believe that it's enough.
Yeah.
We don't believe that it's enough.
That's true.
Because it's always, I feel like there's a level of, like I said, proving, not just to you, but proving to others that, my parents are proud of me, but also like my parents also have other children who they're very proud of, who do different things, and they're also great. Like, and it's more so, I really do believe that as you, like I was explaining, climbing medicine, subspecializing, you find that there are not a lot of people that look like you in certain subspecialties, especially pulmonary and critical care medicine. I see a lot of people who look like you. So it feels a little lonely at times.
What would you say to a young Black girl in med school, like the one I met today that told me she didn't want to be a pulmonologist? I'm gonna have to get her on this podcast.
What?
Yeah, the first thing she said was like, "Oh, I don't like pulmonology." She didn't know I was like,
wow.
I was taken aback. I was flummoxed.
What was the reason?
She gave me the reason, and I think she conflated cardiothoracic surgery with pulmonary. So they were mucking about in the lung after a VATS, and it was a persistent air leak, and that became a whole trauma event. And I think this was her first like time in that kind of setting, and so I think she tied that into. But that's what I told her. I said, "Come on, man, come on back. Palm is away. Palm crit is away." Anyway,
okay.
Anyway, so something I've always wanted to ask you, right? Knowing some of your journey, right, is how was it throughout all of that to be wife at the beginning and wife and mother now?
Wow. It's so funny because literally my husband and I, JB, we just literally had a conversation 2 mornings ago. We woke up and we were like, this is different. Like both of us, it was like, I was thinking it and he said, we're like, this is different. So we got married before I even applied to med school. Like I told you, he was the main reason why I went ahead and applied. So I got married in 2009. We were so young. Like I think back of how young I was 24, he was 25. Isn't that crazy?
Yeah.
Who does that? But we did, and we're still happy. I could not ask for, I didn't ask. I was blessed with the best life partner who's balances me. Like I'm here and he's here and it works well. He was such a supporter. Everything that I could possibly need and want, he provided that and made the way clear for me to just do what you want, whatever you decide. He's that, and you know him. He's literally like, whatever you want. And at first it it was a lot because I'm like, really? But no, he means that. So I went through the journey with someone who was super supportive. And then in addition to that, just family members around that, just like, whatever you need, you can't come home, we'll come to you. We'll visit you, give you what you need to get out of your space. Like that's how we all operated during that time. But it's so stressful and I don't want to say stressful because there's a level of stress that comes with pretty much any job, but especially when you can't give your time in the way that I think we would want time.
Especially to people you care about.
To people you care about.
Right.
Like I wasn't able to give that time. And so it was, I got a moment, let's do it. Or I know that I'm going to do this at this time. I have this free period, so we're going to make that time. So I appreciated having that flexibility of time. But for me and for him, it wasn't even just time. It was just my brain space. Like we could be on vacation and I wasn't on vacation.
Yeah.
You know, like he understood that, but he also helped work through the, hey, we're here, focus. So he had to deal with that too. And I think now, even though I've still got things that deadlines we have to make, boards, like we still have things that we have to do in medicine. But now that training is done, I literally sit back and I breathe and he's breathing. And it's like, what are we doing today? When is your next time off? Oh, where are we going to go? What are we doing? Do you have, like, it's
different.
It's the freedom of feeling like you can breathe as a couple in our relationship. It's like the luxury of having time, having resources to do the things that you want to do, and being around people that care and love in the same way that you do. Like our circle of friends, like, is so important to us that there's no pressure to be anything more than just the people we are.
Right.
There's no pressure to physically be in any given place at any given time. And there's no pressure to the quality of that time. Does that make sense?
Yeah, absolutely.
You know, and so we're like excited. We literally said to each other, we're excited about this. So this is cool to not have the stress of somebody else's expectations for you, because that's what training is. It's, yes, you want to perform, but most of it is make sure I do this right. Like there's this expectation for somebody else, and now there's nobody else. It's just you. And by you, I mean me. It's just me. Not just be who I am. And that, I think, is probably the most fulfilling thing I think about the last month or so is I could just be me wherever. And there's nobody saying, well, are we following this? Isn't like, no, I get to be me. It's 100% authentic, my 100% authentic self, and share that with people, but also see people actually get better.
Yeah.
Like that impact. And my husband can see that. Because I'm that way, I'm able to be that way at home.
I'm curious to see, I wonder, maybe I'll have to ask him this, is how has he, and you can answer this for yourself too, how have you changed in your marriage throughout this journey? Ooh. And certainly, because you guys have had some pretty important milestones, obviously. And who you are today, and this is life in general. Who you are today isn't who you were, 5-10 years ago.
Not at all.
But how has medicine and the journey through medicine changed you in such a way that you can, apply that to or you can say, this journey in medicine has changed our marriage for the better in this way? What would your answer to that question be? Other than making it adding an extra layer of hardship.
Yeah, right.
Right. And toughening you up, to endure. What would you say is one of the benefits? Because he was literally there before. And he's gone through all of this with you. He's gone through
everything.
All of this with you.
Is it possible to pause on that question and then come back to it?
Yeah, of course. You want to dwell on it?
I want to dwell on it, but I also want to literally pause. Literally pause.
All right. And we're back. Had to take a quick break. So where were we? Oh, I was asking, how has this process how has this process enriched your marriage and your role as a mother?
Oh, wow. You added that last part because you
I
didn't
did.
talk about my role as a mother.
I did,
So
I
like,
did.
okay, so now let me think. I mean, it's not a hard question. Like, I believe that this process allowed, I think, JB and I to see each other, like to actually see each other and to see what we both were capable of as separate humans, you know? The level of his love and support and ability to make things happen, like, is,
He's an action man.
he's like, he gets it done.
Yeah.
He gets it done. But not only that, his level of love and support for me. So before getting married, I'm like independent. I do everything myself. Like, I got this. I don't need, literally, I remember telling him, as ignorant as this sounds, even thinking about it, like, I don't really need you. Like, who tells somebody that?
Right.
You know? And he looks at me like, you kind of crazy. But like, you're kind of crazy. But really, I realize how much I do need him, how much he grounds me, but also how much he's allowed me to be me and seeing things about me that I didn't know existed, allowing me to be in a way that I didn't know was possible, to be more authentic. He is the person that makes me comfortable being who I am, wherever I am. It's because of him.
That's beautiful.
Literally, like, I remember I wanted to wear different nail polish. Color again. I want to wear nail polish. Is this acceptable? Is this okay? Are people going to think that I'm not presentable? And he was the one that says, it's presentable because you have it. It's you. You wear whatever you want because it's you. And if they can't accept you, then
They ain't for you.
they're not for you. Like, he's that person. For him, I would say, I think he realized even in his career and what he wants to do in life, this journey helped him realize he doesn't have to, the stress, I'm enough stress for him. Like, my job is enough stress. He needed to be that balance. And he realized the type of work and mindset that he needed to have in order to carry our family, to be there for our family. And so he at least he tells me, he's fulfilled in his current job, but also he's excited about doing all the other things that he wants to do. What he wants to do is be a stay-at-home dad and play golf. And we're working on that. I don't know about that. But that's what he wants to do. And as far as my my daughter, Joelle, she is amazing and brilliant and a package that I wasn't expecting. I wasn't expecting for her to be so bright and so smart and so kind, but also very determined. And so when I see her being so strong, but and the weirdest thing is she's strong, but even in a 4-year-old body, it's like she knows that she can't do everything. She can't be everything. She said that to me this morning. She was throwing a fit. She was throwing a fit before it was time to go to school. And I said, Joel, you have to learn. Like, you can control yourself. You don't have to cry for these things. Use your words, blah, 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 blah. You know, this girl said to me, but mommy, I can't be good all the time.
Oh, Lord.
I said, you are right. You are so right. We are not good all the time, and you don't have to be. Seeing her be strong and intuitive in that, as a 4-year-old, I want to make sure that she sees me a strong person, but also I want her to see me mess up.
Right.
One of my attendings told me that. She said, don't be afraid to make mistakes in front of your kids and just say, man, I messed up. Because that's how they're going to learn to be okay with messing up.
Right.
Because we project our A type as physicians, and know a lot of us have the similar personalities of do it right, do it right, do it right, do it right. Don't mess up, because we've lived a life of don't mess up. Mm-hmm. That's how we've been reared in medicine, right?
That's how we've been conditioned. Yeah.
We've been conditioned to be that way. She needs to know that so she doesn't have a complex. Our children need to see it's okay to mess up. It's okay to not be perfect. It's okay to not be good. I'm going to be bad right now, Mom. That's just that. You're just going to have to deal with my 4-year-old badness. And I say, okay, I appreciate that. So I think had I not been in this position, I don't think we would be these people. We would still probably be good people and great people and meet great people, because I think we are the type of people that we attract who we attract. But the lengths of understanding what even our own potentials are and what we can do, I don't think we as a family unit would be able to be that and to do had we not gone through this journey together. The good, bad, like all of it was like for what we needed. It was for good. It worked for good.
I love it. I love it. Well, thank you so much for taking time off in your week off. Is this your last day of your week?
Yeah, you caught me on I'm going to go back to work tomorrow.
I appreciate you taking the time.
Absolutely more than happy to be here.
We're going to have to get you back for some more at some point.
Oh, yeah. There's a lot I could say,
But I appreciate you all the way, all the same.
I appreciate you, Dr. Ezema.
Thank you, Dr. Brown. Bye.
All right.
All right, y'all.